Searching for alternatives to back pain relief offers choose chiropractic treatment. More than 20 million Americans visit the chiropractor care. Chiropractors use a variety of alternative pain relieving treatments, including spinal manipulation, stem, and muscle work. Research has shown chiropractic care can also be helpful in treating neck pain, headache, osteoarthritis, and fibromyalgia. Doctors of chiropractic have broad diagnostic skills and are also trained to recommend therapeutic and rehabilitative exercises, as well as provide nutritional, dietary, and other counseling. Chiropractic care is our topic tonight on Doctors on Call with our guest, Dr. Shelbe Darnell of Plainfield.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Shelbe Darnell, DC, grew up in Plainville, Kansas. She earned her bachelor's degree in human biology and her doctorate in chiropractic from Cleveland University, Kansas City College of Chiropractic, graduating cum laude. Dr. Darnell earned her 100 hours of functional medicine and chiropractic family medicine certificate from the Council on Diagnosis and Internal Disorders. She has completed more than 300 hours of postgraduate study of diagnosis and treatment of internal disorders. Prior to Restoration Health and Chiropractic in Plainville, she served at KC Core and Overland Park Regional Medical Center. Give us a call at 800-337-4788 toll-free with your medical questions about chiropractic care today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or chiropractor. Thank you so much for joining us tonight, Dr. Darnell. We're going to go ahead with some questions of our own while we wait for those phone calls to come in. First of all, let's talk about why a person should choose chiropractic care.
A person should choose chiropractic care for any of their pain, typical their day-to-day living, if that is causing them any pain, or if they even had an accident and it came on all of a sudden. If they have neck pain, back pain, low back pain, mid-back pain, even any pain in the extremities, the arms or the legs, they can seek chiropractic care.
Excellent. What conditions do chiropractors in general treat?
Typically we are sought after for back pain, but we can treat anything relative to the spine, or really we are musculoskeletal doctors. So headaches, neck pain, low back pain, sciatica, I see plantar fasciitis. We can help with carpal tunnel symptoms, things like that.
Excellent. And how does a person go about selecting a doctor of chiropractic?
That's a good question. If you've heard any of your friends or family, if they have a person that they enjoy seeing, that you can go off their referrals, or you could even ask your primary care provider if they had a chiropractor that they would like to recommend for you. A lot of people do like going to Google. You can do a Google search or even look on Facebook and you can read people's reviews and choose a chiropractor that way.
Is it important to find someone who, if you go to one and you maybe don't click, is it important to just keep trying until you find one that you really think is helping?
Typically, yes. I think that looking online, you can get a pretty good picture of what doctor you're going into. And it all depends on what you're looking for. If you just want to get adjusted, you'll find that information usually on their website or on their Facebook page if they just adjust, or if you're looking for somebody who does modalities, muscle work, E-stim, decompression, things like that. You'll be able to find that online. If you are going to a chiropractor and you don't feel like you are getting the results, maybe you don't click with them. If you feel comfortable talking to them about, what your goal is and what your intentions are, and maybe they're not being met, maybe they can fix that for you, or they might help you find another chiropractor that is a better fit for you.
And is it important, do you feel, coming from a chiropractor herself, not to give up on chiropractic altogether if you're not seeing the results right away?
Yes. Yes, because not all chiropractors practice the same way. We all have our different, really specialty areas, and if you do feel like you need someone else, they should be able to recommend somebody else for you if you guys aren't the right fit for each other.
Excellent. What kind of training and education is required to become a doctor of chiropractic?
So applying for chiropractic college, normally people go in with a bachelor's degree. I know the chiropractic college I went to, you could earn your bachelor's degree while earning your doctorate degree, but typically people go in with their bachelor's degree already, and then it's another 4 years of schooling, and we learn everything from skeletal anatomy, microbiology, neuroanatomy, all sorts of different classes are required.
Excellent. Now, how does your chiropractic treatment differ from others?
I spend a large majority of my time with patients focusing on muscle work and muscle imbalances, making sure that those muscular structures that are attached to those bones that we're adjusting are not taut and tight, pulling on those bones. This makes for a more effective adjustment and longer lasting adjustment, and typically people get more pain relief whenever those muscles are not causing the tightness and tension.
Okay, according to your website, you spend 30 minutes with each of your patients. Can you explain why your appointments are pretty extended?
Yep, so in the very beginning, we kind of go over how you did after the last appointment. Make sure that we're progressing the way that we are expecting, that you didn't have any more falls, injuries, or accidents, and just make sure that we're headed in the right direction. And then we start our care again. I do typically 25 minutes of muscle work with each patient, and that depends on how many areas of complaint you have. Sometimes if you only have one area, it doesn't take as long. But I treat every single, area that you're having pain. Usually that takes about 25 minutes, and then we spend the rest of the time adjusting and doing any type of therapies that we need.
Can you explain why you choose to do this method?
Yes, it's a lot more effective because if you think about your spine and your entire body, it's all made up of muscles and fascia, and that's how the muscles are attached to the bones, and that's how we move, that's how we do our everyday activities. So we have to make sure that those muscles aren't pulling on those bony structures and causing the joints to be fixated, and make sure we have enough motion, and then that's when we adjust.
Excellent. Oh, explain why there's so much extensive paperwork involved when you go see your chiropractor.
There's extensive paperwork, especially in the beginning, because we need to know, as chiropractors who are making a diagnosis, exactly what's going on. We need to know any prior history, any medications, any surgeries, because that will all change the way we adjust and where we adjust and how we adjust. So that is very important to include on that intake paperwork. And we just need to know kind of what's causing the pain, and we want to get down to the root cause of what that is. So that is why it's pretty extensive in the beginning.
All right, good to know. Okay, well, we're going to go to the phone lines. We've got Sarah on the line from Hayes. Hi, Sarah. Go ahead with your question for Dr. Darnell.
Hi, I have an infant that has colic, and I've been told a chiropractor could help, but I'm a little skeptical about bringing my baby. So could you tell me what you think about this?
Yeah, I have 2 children of my own, and I have adjusted them since they were probably about a month old. I would suggest you find a chiropractor that has experience adjusting children and is comfortable doing that. The chiropractic adjustment for infants, babies, and even toddlers is very, very gentle, and it can be effective for colic. It's one of those things, there's not a whole lot of research on it, but a lot of parents have found a great benefit in chiropractic care for infants. It is very gentle. It's not the typical adjustment that you think of for an adult. So if you are feeling uncomfortable with it, I just suggest talking about that with the chiropractor so they know that, and they will, I feel, would really explain to you and show you exactly what is going on.
Let's talk about that, the difference in ages. Do you usually work on clients of all ages?
Yes, so I do treat my own kiddos. And I have seen other kiddos in practice, toddlers, maybe, tummy aches, they feel that their back isn't, right. They don't really know the difference of pain, but we do adjust really anyone from any age, and even those in their elder years, they find benefit from.
Excellent. Let's talk about that initial appointment. What is a patient going to experience?
Okay, so typically you fill out your paperwork first at any chiropractor's office. You'll sit down and you'll go through that paperwork. We'll ask you any questions that we have about any of that. And then that takes a large majority of the time, is questioning exactly what's causing your pain and where, in order to make a diagnosis. So usually we'll start out taking vitals, and then we kind of get to looking at the body, see exactly what's going on, do some orthopedic test to rule out anything that we're maybe thinking it might be a disc issue, it might be something else. So we do those tests to figure out exactly what is causing your pain, and then make sure you're a chiropractic candidate, and then we go on to adjust and do any modalities that we want.
And I'm sure there's many, but what are some of the benefits of chiropractic care?
Chiropractic care can alleviate really a lot of pain and muscle tightness and tension. A benefit from the adjustment itself is reduced joint inflammation and an increase in mobility.
Excellent. And how is chiropractic care beneficial for those who are active, that lift weights and exercise?
Yeah, it can be very beneficial because if you think about whenever you're lifting weights or really moving any part of your body repetitively, you're continuously lengthening and shortening a muscle. So whenever we do this repeatedly, our muscles can tighten up over time. And so the benefit to chiropractic care, and especially the muscle work, is we make sure that there's no imbalances within those muscles, and we're not having any of those fibers actually adhering together and causing knots and trigger points. So just making sure that everything is moving effectively is really beneficial.
And on the flip side, how can it be beneficial for those who maybe more have a desk job, if you will?
Yep, so if we're sitting for a prolonged time in a certain position, those desk jobs typically pull us forward with our arms up. So we have those forward rolled shoulders. This puts a lot of strain on the neck. And when you strain that area for long periods of time, whenever you can start feeling pain over that period of time, but especially when you go home and you rest and you pull, you're coming back and pulling back up to neutral, those muscles will really tighten up. And that can be painful. Typically, I find that those types of people have the most pain in the morning because those muscles have tightened up throughout the night, and then they wake up with a lot of pain. And then once they get moving again, the pain typically subsides a little bit for them. But chiropractic care can really benefit you in making sure that those muscles are loosened up and help with any mobility that you need.
Do you encourage your clients to participate in certain exercises to help keep them in place, if you will?
Yeah, I typically always show my patients exercises after I get done treating them, just to help them progress while they're not in office, just so that you're headed down the right road and we can basically keep treating you while you're at home as well.
And how important is it for a patient to actually do those exercises?
Yeah, you'll notice a benefit in doing them, especially even with something acute where it just happened. If we can get you treated and then you do those exercises at home, you can progress really quickly compared to if you would just go home and rest.
Okay. Let's talk about, does the chiropractic care require x-rays?
Sometimes, yes, it does, especially if we have any injuries or accidents. Your chiropractor will rule out whether we need x-rays or not. It sometimes with an injury accident, it might be required to have an x-ray before adjusting, but typically your chiropractor will know whether they should be required and done before treatment or not.
And is the care covered by insurance?
It depends on what insurance you have, but yes, typically chiropractic care is covered under insurance now.
Excellent. And let's talk about, on average, how many times you treat a patient for back pain or for what?
That will depend on a few factors. One of that is how long that patient has had pain. If it's been 3 months they've been having this pain going on, or it's only been, a couple days since the pain coming on, that really will affect how long your treatment is. So if you've been putting it off for a longer period of time, you'll typically have to come in a few more times than if it would have happened, 2 or 3 days ago. Another thing that will affect how long your treatment plan is your daily activities that you do. So if you are doing something every single day that aggravates it versus you did something that you don't normally do and aren't going to continue to do, we can typically have a shorter period of time and get more benefit than if you're doing those every single day repeatedly.
And are all patients adjusted the same way?
I would say no. It depends on how they respond to treatment, or if you're a new patient or if you've been to a chiropractor before, you can talk to your doctor about what you like and what you don't like. If there's a specific thing you don't like, using the drops on the table. Some people like that and some people don't. So if you just communicate with the doctor, I would say not all patients are adjusted the same, and age affects that too. So the adjustment will look very different from a younger patient versus a healthy mid-adult person or an elderly patient.
Now, is there ever a time that a patient comes in and you aren't able to adjust them, or you have to wait a little while for something?
Yes, I've seen that actually quite a few times in younger adults. They hurt their backs doing something that they don't typically do, and their muscles are in just a really tight spasm. So if we're having trouble standing up, if we're not able to move a lot, we have sharp shooting pain into the lower extremities, that first visit I typically just do muscle work and I don't adjust, because sometimes putting that high amplitude adjustment into those muscles that are already really irritated will actually kind of have a rebound effect and cause a little bit more irritation. So if we just work those muscles out for the first appointment, then they come back, and once those have relaxed, then we can adjust.
And what is the importance? You hear sometimes when somebody has an injury that they need to ice it, they need to heat it. What is the difference there?
So I would suggest using ice only for acute injuries where you're trying to reduce the initial swelling. So anytime you want to reduce inflammation, you can use ice. However, when we are talking tight muscles or any tension that you're having on, we want to get blood flow to those muscles to allow them to heal. And so the best thing for that is heat. Even they're now coming out with more research on ankle sprains. Unless there is a full tear of those ankle ligaments, it's best to weight bear and move around as much as possible. So instead of doing the normal rest, ice, compress, and elevate.
Excellent information. We want to remind our audience that we are talking about chiropractic care tonight with Dr. Shelbe Darnell from Plainville. If you have a question for her, you can give us a call at 800-337-4788. Well, now if a person has had back surgery, can they still see a chiropractor?
Yes. So that's another place that it is very important in the intake paperwork to include any surgeries that you have previously had, and sometimes even making sure at every appointment we talk about their surgery location and exactly kind of what's going on. You can still receive chiropractic care typically above and below the areas of surgery, as long your doctor will decide if you're able to, but the muscle work is still beneficial for those patients.
And can a person adjust themselves? You see people trying to do that all the time.
Yes. So the adjustment is very specific. We're taught exactly what direction, with what speed, and kind of what depth we need to do adjustments. So doing an adjustment on yourself, when you kind of twist your neck and push, you can make things pop, but you're still not probably getting the right motion in there, in those joints. And one thing that does, you're really not being specific to an area that you're adjusting. So you can put mobility into areas that you don't want mobility, and that will also lengthen ligaments to an abnormal length, so it can make it harder for chiropractors to adjust you as well.
Now, what are the most common conditions you treat in your practice?
Headaches are a big one. I see a lot of headaches. That muscle tension there at the base of the skull really can bother patients. I see a lot of sciatica and low back pain due to some glute tightness. And another one I see a lot is carpal tunnel, that numbness, tingling in their hands. The muscle work within the forearm can actually be very beneficial for those patients. And some that people don't think about too is that pressure behind your ears. Sometimes you can feel that maybe with some sinus congestion, you can feel that pressure behind your ears. And that's one of my favorite ones because you get a lot of benefit from even just one treatment. Doing the muscle work kind of down the side of the neck and adjusting the ears can be really helpful.
Interesting. And are there methods of treatment for those suffering with chronic pain in chiropractic?
Yep. So with chronic pain, it's probably going to take a longer treatment plan for you, but you'll still find benefit, especially when you've been having pain for that long. Usually there's muscle imbalances or just joints that are fixated more than normal, so you do get a lot of benefit from chiropractic care.
And you mentioned headaches. What types of treatment do you recommend for migraines?
I do a lot of muscle work, like I said, in the suboccipital region, which is right below the skull. Doing that muscle work, usually those headaches are caused by a lot of tension back there. So doing the muscle work, the myofascial release, and then adjusting. I always suggest heat for those types of tension headaches. That will help as well at home. And then I do my kinesiotaping and spray with biofreeze.
And you've mentioned myofascial release a few times. Let's explain what that is.
Okay, so myofascial release is all the muscles in the body are surrounded by a fascia to give them structure. When we use muscles, like I was saying, they can adhere together and they can just stay constricted over time. So what I do is use long sustained pressure and just work out those muscles and try to re-lengthen them.
And you also mentioned that popping sound. What is that popping sound when you hit the adjustment?
So that popping sound comes from when that gap is, when the joint is gapped enough, there will be a gas release, and that is the popping noise.
And what is, something we haven't touched on yet, what is cupping?
So the cupping is, it's Chinese medicine where there's a plastic cup and you kind of suck the air out, and when you suck the air out, the cup is like on the back and you suck the air out, and that just kind of pulls the fascia and the skin within this cup. And so that pulling will pull any stagnant blood, and just kind of the same idea with the myofascial release, just try to release that fascia with that tension brought up in that cup.
And who is a good candidate for cupping?
You typically see it on athletes, but it can really be used on anyone that has chronic muscle tightness.
Now we had the caller that was asking about the infant. What about pregnant women? Or is that an option for them, chiropractic care?
Yes. So that typically with pregnant women, we really look at like the way the pelvis is aligned and the sacrum. And then to compensate for the growing weight in the front, our muscles in the back really tighten up. So the myofascial release and the pin and stretch in the glutes are really beneficial for that. You hear a lot of pregnant women complain of that sciatica pain. So that can be very beneficial. What I'm referring to with the sacral and the pelvic analysis is what's called Webster's technique, and that is specific to pregnant women. And not only is it the pelvic and sacral analysis, but they also work on the round ligament and fix any imbalance side to side on that round ligament, and that promotes just taking that tension off. That can allow the baby to get in the proper position, just taking the tension off those round ligaments.
You also mentioned kinesiotaping.
Yes.
What is that?
Okay, so kinesiotape in itself is it's a stretchy tape, and you put it on the skin, and the sensory fibers within the skin send neurofeedback to the brain to promote healing and to relax the area.
Okay. And do you use that on all your patients?
I use it on a large majority. It can really benefit those with tightness that when I like to send people home with that tape, and that kind of helps us progress over time while you're not in the office. It is really useful, and practically anyone can use it as long as they don't have any skin irritation with it.
I'd like to discuss a little bit about e-stem therapy and what that is and the effectiveness of that.
Okay, so the e-stim is their electro pads that are hooked up to a machine, and that puts electrical current to the pads, and that electrical current just fires the muscles, and it will fire on and off and on and off, and that is really good for pain relief.
Okay, what about Hypervolt?
The Hypervolt is a massager tool, and so it's just a quick percussion, and that is good for pain relief as well. You see a lot of athletes and people at the gym like to use that for those tight muscles.
And Factor?
Factor is instrument assisted soft tissue mobilization. So it's it's a steel tool, and we use some type of cream or some type of gel, and you just kind of rub it up and down on the skin, and that breaks up any scar tissue or adhesions that have formed within the muscle or fascia.
Excellent. And one more time, let's discuss, we're just about out of time, but who is a good candidate to come see a chiropractor?
Okay, really anybody who has any complaints of pain, really anywhere in the body. We diagnose and we can treat majority of the musculoskeletal complaints.
Excellent. Well, we covered a lot in 30 minutes. So thank you so much for being our guest tonight. On our next Doctors on Call, we'll be discussing pain management. You can email questions to us for our next program at doctors@shppv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.